This is one of the most revered places on the landscape now. Positive COVID-19 cases, a highly contagious virus, are being managed here. And for the health workers, it's a fight they must win at all costs. Kenyatta University Hospital is Kenya's main treatment center. It's outside Kenya's capital of Nairobi, along the Eastern Bypass. It's a new modern hospital, and so it offers the country lots of space in the battle against the global pandemic. Kenya has never experienced such an infection for decades, but there is always a first time. Numbers of those infected by the world's deadliest killer is rising by the day. Numbers of those hospitalized, an indicator of how Kenya is in the midst of an outbreak. We are in one of the facility's intensive care unit, and a patient is really breathing hard, literally. There is neither a cure nor vaccination. His survival is hinged on hospital workers helping him breathe until his body can fight back the new coronavirus. It spreads through droplets when a person coughs, sneezes, or speaks. It only takes one to infect millions. It's deadly if the country cannot get ahead of it.
We have put both confirmed patients and suspected patients. They are here, but we have separated them. The confirmed are on one side and suspect are on the other side. Yes, but before we go in, first of all, we have to change.
It means you have to be in full gear.
Yes, you have to be in full gear for the PPEs, that is personal protective equipment.
This is literally Kenya's red zone and can only show the entire country what to expect if the virus continues to spread. This hospital is the most modern, up-to-date facility to be seen in East and Central Africa in recent times, and it has provided the government with space for the isolation and treatment of COVID-19 patients. But experts are warning that if the curve is not checked, then this facility could get overwhelmed. This is our journey into the contagion that is slowly but surely digging into the Kenyan population. It's tough to work or be in here. One must be brave. Any slight mistake could leave one infected. Staying safe starts with donning, the process of wearing protective gears, masks, face shields, goggles and gowns. Utmost care must be taken.
I feel scared a little bit.
Yeah.
But I have to do this. People have to know what frontline workers are doing.
True.
Everyone in the ward, save for the hospital workers, is COVID-19 positive.
Knowing that I'm protected, I'm not afraid, and I can easily go in. And for me, I take them just as any other patient. I have to maintain their dignity because these are human beings. So I have to maintain that at all the times. So I attend to them just as I would attend to any other patient.
We meet with John Shira, not his real name. He tested positive on the 2nd of this month and has been here since. John was traveling to South Africa from his home in Nigeria on the 23rd of March when he was quarantined at the JKA. He suspects that he acquired the zoonotic virus at the airport.
So I stayed at the airport from 23rd, 24th, 25 and 6. And the condition there was not very conducive and all that. We were exposed to so many things. And the challenges, there was this elderly woman, I think she tested positive also. She was also going to South Africa and we were from the same state. So I tried so many things I could to assist her while we were at the airport. So I just felt the exposure of the things I was exposed for those days from that 23rd to 26th before we moved to the quarantine center.
Dr. Jeremy assured him he will be tested soon to ascertain whether his body had managed to ward off the virus. But until then, his laptop and the outside environment he only enjoys through his window are what gives him hope.
It's not an easy challenge if your mind is not strong, it's difficult to take. But
yeah. So this is just to make sure you're reducing the risk of infection.
So what really goes into your mind, especially if you go in there, every door we are seeing here, there is a patient?
Yeah, all these doors have patients, and this is just one ward. You can imagine we have about 8 wards, so each door has a patient. There are some who have mild symptoms, others who are moderate, and then for the critically ill, that's the severe patients, are in a different place. So that has helped us, because we realized it's very easy for even an animosity to develop among the patients who are symptomatic, being put together with those who are symptomatic. So our plan is, if you're able to divide them that way, then even in the wards, in case our numbers outgrow, and you're not able to give every patient their own room, then you can put patients in one ward who are symptomatic, depending on their classification. The other thing that we are making sure is that even when in case we are going to do that, we are still maintaining the 1.5 meters distance. So the social distancing is also continuing even here. And every patient must have a mask as well.
As we left the tunnel ward, another challenge awaited: the removal of the protective gear. Anyone living here must always suspect that the gears have been contaminated and so have to be removed with care, the process they call doffing. Dr. Jeremy was the first to go. We followed, and our cameras were not spared. That is what isolation staff must always do.
We are also getting guidance from the Ministry of Health how to to isolate people. If you come at the main entrance, you see that there is green and red. The red is for maybe people who are attending to the patients, and therefore they don't mix with everybody else. The red zone, we have the red zone, and now for us we have also the other zone, the green zone, if you call it that way. But so we are trying to do whatever we can to separate, so that if, for example, a lift is for the red zone, then it's just for the red zone. Maybe a lift is for the others. So we are trying to even here separate just to increase the chances of keeping safe.
Initially we were a quarantine center where we initially said eight clients. But since being categorized, we have now managed to see over 123 patients, majority of whom now currently are positive and they are undergoing treatment. Most of them are stable, apart from one who is in ICU. Initially he was in bad state, but he's really improving because he had some other comorbidity.
Government is urging Kenyans to strictly adhere to restrictions put in place, or the consequences could be dire. Kenyatta University Hospital says it's prepared to offer more space if need be. Enock Sikolia, Citizen TV.